Assignment 22.2 Exercise Prescription by Finley Deedman. Within this assignment, I will be presenting and analysing exercise prescriptions in response to three target groups: the elderly, disabled, and pre- and postnatal women. To provide a guide and reference to what types of exercise is most suitable for each group, creating an insight into what intensity, type, and duration of the exercise should be for each target group, whilst also presenting individual factors which each group should be not exposed to when exercising, known as contraindications. According to Cancer.gov, a contraindication refers to a reason for a person to not receive a particular treatment or procedure because it may be harmful. Therefore, analysing each group's specific set of contraindications should enable them to avoid them to perform exercise safely and efficiently alongside their given target group. The first target group I will be talking about is the elderly. I will be presenting an exercise prescription to the elderly. As age has numerous effects upon an individual's physical state. This is because as the body ages, it typically becomes weaker and more fragile, leading the elderly to be more prone to injuries, particularly when performing strenuous activity. This can be supported by medlineplus.gov, who stated on their website that the strength of the bone tissue you do have also starts to naturally decrease, leaving less bone. The bone density to decrease with age, increasing the risk of breakages. As a result, when prescribing exercise to an elderly person, it is vital to ensure you are fully aware of the elderly's increased risk to injuries, highlighting the importance to always consult the individual's doctor before establishing an exercise prescription to ensure they are medically fit to perform exercise without a significant risk. Once this consultation can be conducted and the doctor has stated it is safe for an individual to perform exercise, an exercise prescription can be devised for a subject in accordance with their personal requirements. To ensure the safety of the elderly when exercising, it is important not to over-prescribe, as setting too intense exercise will greatly increase the likelihood of an injury occurring. Therefore, when creating an exercise prescription for the elderly, it is vital to keep exercises to a low intensity while also providing a small amount of physical challenge to still engage their bodies positively and promote physical progression. As maintaining exercise throughout old age can reduce the rate at which bone density and muscle mass deteriorate, whilst simultaneously improving cardiovascular efficiency by improving the cardiac heart muscles, which will reduce the risk of the individual suffering cardiovascular issues such as heart attacks, clots, and strokes, as the arterial and cardiovascular systems will be strengthened through exercise. Types of exercise I would recommend to the elderly would primarily be cardiovascular aerobic based activities, such as low intensity walks, yoga, and tai chi, all of which are low intensity, therefore minimising the strain placed upon the elderly individual's body and particularly their joints. According to familydoctor.org, seniors aged 65 and older should get at least 2.5 hours of moderate aerobic exercise every week. This would average out to around 30 minutes of exercise per day of the previous stated exercises, which would be low intensity aerobic cardiovascular exercises. Building upon this, although exercise is essential to maintaining health into old age, moderation is key, as overexercise can be very dangerous for the older generation, as overexertion increases the risk of injuries such as sprains and strains. Therefore, keeping to the previously stated 30 minutes of moderated exercise is crucial to maintain a healthy lifestyle when venturing into old age. Furthermore, it is also important to not neglect strengthening exercises, as it is recommended for elderly to perform strengthening exercises at least twice a week to maintain bone density while stretching their body's muscle fibers and overall flexibility. Examples of strengthening exercises for the elderly would include stretches, such as toe touches, wall push-ups, squats, and lying down bicycle kicks. With the exercises relying primarily on the body of the individual as the resistant force, using their own weight as a resistant force, to ensure the resistance is not too great while still engaging the bodily fibres, as using external weights could place increased strain and increase the risk of injury. These exercises should be incorporated into the individual's physical routine within 20 to 30 minute sessions, depending on the physical state of the individual. However, rest periods are vital within strengthening exercise to provide time for the individual to recover. As a result of this, I would recommend a 30-second on and a 1-minute rest plan, with the subject performing exercise for 30 seconds followed by a 1-minute rest period to ensure they are fully rested and not overstrained in between exercises. A reason for a time frame was more suitable than a rep number, such as 10 squats. It's because a time frame enables the individual to perform at the rate they feel comfortable with, not pushing themselves too hard. So if they have 30 seconds, they could do 2, they could do 10. It's how they physically feel, so it's up to them to push themselves as hard as they want. An example of a mock week for an elderly person could be seen in the graph presented. So, like, for example, on Monday they could go for a gentle aerobic walk, and this would be mostly with no inclines, just flat walk. And then on Tuesday they could do just as I said, the 30 seconds on, 1 minute off. So this is some wall push-ups, squats, lying down bicycle kicks, lunges, and step up and down on a step. So these are all to engage the body's muscle fibres and increase muscle density and bone density. And then after these 2 days, I would recommend a rest day just to ensure they are fully rested to not overexert themselves. Moving forward, when prescribing exercise, it is vital to fully understand the risks of how high the risk is relating to each target group in response to their exercise. This is why individuals must always consult with their doctor to ensure they are safe to perform exercise, and ensure they do not have any contraindications. Contraindications refer to factors which prevent an individual from performing an activity, as it may place them in significant danger. However, there are 2 types of contraindications: absolute and relative. Absolute contraindications refer to factors which mean an individual cannot perform the activity under any circumstances, as it could cause significant injury or damage to them, possibly even being fatal. Whereas relative contraindications refer to factors which pose a risk. However, as long as the individual is cautious, they should be safe, as the risk is significantly lower than an absolute factor. Contraindications are all about weighing the risks against the benefit to ensure the benefits of the activity outweigh the risks. So if a contraindication presents that the risks are higher than the benefits it will provide the individual, that is when it becomes an absolute contraindication. In response to the elderly, contraindications could take form in many different ways. According to ncbi.nlb.gov, examples of absolute contraindications. Examples of which could relate to the elderly include respiratory failure, complete heart blocks, severe hypertension of 180 over 110 or higher, as exercising with any of these issues could be fatal, therefore meaning individuals with them should not perform exercises unless otherwise informed by their doctor or another medical professional. Whereas in response to relative contraindications, examples would include issues such as arthritis, which is extremely common amongst the elderly, where the cartilage of the joint deteriorates, making joint movement very painful. However, this is not fatal. Although exercise therefore making it a relative contraindication, as it cannot kill them, but it can be very painful and can cause more injury. As a result of this, individuals suffering from arthritis would be able to perform exercise, however possibly under adapted routines to minimise their pain. For example, low intensity swimming could be used as an alternative to normal exercise to work around their personal activity, as the water will alleviate the strain off the joints, minimising the pain when exercising from arthritis, as the water alleviates any pressure off the joints, showing how individuals with relative contraindications may exercise, but however under altered exercise plans to accommodate to their individual needs, to make the exercise as enjoyable as painless as possible, while also reaping the benefits of exercise.